I'm Tom Connelly. I'm a dentist in Los Angeles and here in New York City. I do some very interesting dentistry, mainly diamond work, precious metals, stuff that you don't really see on the average person. In addition, a lot of times while our patients are sleeping, we do tattoos. So sometimes we'll run 6, 8 artists at the same time while the patients are having their mouth redone. And we've created this really interesting new business of teeth and tattoos. In college, you have to declare a major. And I can remember declaring business as a major and just being nauseous about it. Just thinking, it's just so boring, like a business guy. And then I just kind of had a eureka one day. Like, I'm gonna fix teeth. And like, just teeth. It just for some reason just stuck. I can't really say why, because it doesn't really make any sense. But, fast forward to 20 years, here we are 30 years later, that makes sense. There's really restorative dentistry where you're doing fillings and cavities and you're replacing diseased tooth structure with silver or plastic or gold. You're just patching holes. And then you've got more elective side of dentistry where you're taking porcelains and different materials and improving the aesthetics of somebody's smile electively. There's usually nothing wrong with the tooth, we're adding. Cosmetic dentistry became my forte. And then from there, the patients started asking for different things. And rather than saying no, I said, hey, let's try it. Posty is part of the brainchild of what we do, and he deserves credit for it. I met his name's Austin, at Madison Square Garden years ago, and he needed to get veneer work. And at the time we were starting to put little diamonds encapsulated in the porcelain, so it was bonded in there and baked, so it wasn't glued in, it couldn't fall out, it was literally almost chemically bonded inside the porcelain. And we showed him some ideas and some shapes, and his words to me were like, can we just make the whole tooth a diamond? And we just looked at him and said, I just said, yeah, let's do it. So we did it. I mean, he literally threw a bunch of money at it, and we failed miserably. We wasted easily 40 carats of diamonds trying to do what we wanted to do and understanding what the limitations were from putting a diamond in the mouth. So it took us a couple of years and trial and error, and we reached a point where we put them in and it's really, when you see them in concert and they get a good angle, it hits. I have 4 business partners right now. One of them's an anesthesiologist, one's Travis Barker. I have Odell Beckham and Post Malone. We all work together in this business. Odell was getting some veneer work and just some basic small stuff. And we put him under, and it was one of these things like, can we do a tattoo while I'm sleeping? And we kind of looked at each other and I said, geez, I don't know, I don't see why not. Dentistry is not a sterile environment, as opposed to like open heart surgery or breast augmentation or facelift. It's a sterile environment. So we called up the state board, anesthesiology, and they kind of looked at us like, well, I mean, if an anesthesiologist is putting him to sleep, I guess you can do anything. And we tattooed Odell very successfully. Ganga was the tattoo artist, Joaquin Ganga. And it just kind of became like, I remember Post was in the next week. I'm like, hey, last week we did Odell and this is what we did. I can remember he's like, fuck yeah. Yeah, let's do that. I fucking hate the pain. Let's do it. I think it was Odell then said, next time I go under, I want to get all my tattoos touched up. Can we run multiple artists? And it was kind of like, why not? We can run one, why can't we run 6 or 8? So we put him under, we ran 8 artists. Everybody kind of feels like they're making history while we're doing it. As silly as it sounds, it's like, wow, this is really cool what we're doing. And it just makes it interesting. And then, the patient wakes up and there's all this work has been done. And, we have the advantage of administering antibiotics, steroids for inflammation, really good painkillers, or we have an IV, we can check their vitals. It's like the safest environment. So it just kind of grew from there. But if I had to credit, who are really the founders of my business, is that the brains are Post Malone and Odell Beckham Jr., and that's why they're partners. You know, it was kind of like, you guys, I have to give you some of this. My assistant is Dr. Sarit Carr. She's an amazing dentist. She's been my assistant, so we work together all the time. I had her veneer me, and I didn't want to be awake for that. So I said, let's put me to sleep. I want to go through the whole process. So I lived through the process. It was the greatest learning experience to go through what we do. But something that we're experimenting too with is local anesthesia. And so we didn't really put the patient to sleep because we're just running, it's, you know, one tattoo, one artist, one small area. I don't want to put somebody to sleep for that. You know, we really do a $50,000 minimum if somebody's going to be put to sleep. You have to do some serious tattoos. But at my age, I'm 50, and I can't go to sleep that much. This is 5 sessions with Chewy up here. It was very painful in some areas, and you know, but I have the advantage of, you know, being a doctor, so I can inject and I have access to these things. So, pain-free. I mean, tattooing your arm is one thing. I can wear a long sleeve shirt. Once you tattoo your head, you've crossed over. Like you've crossed over into, I mean, what the general world thinks is a freak. You know, you're like, oh, that guy's tatted up, you know? And so it's weird because I feel like I'm me. And I don't know how to explain that other than those words. I don't feel like a thug. I don't feel like I'm tattooed. I just feel normal. You know, in my profession, it brings a very strange credibility to what I do. Because if you look at somebody like me and you look at my work, it really gets people's brains turning like, wait a second, this guy really does know what he's doing.
I just wonder if you think that we're sucking a little bit of the heart out of what tattooing's supposed to be by being under anesthesia.
Probably, right? Yeah, you know, but let's look at it from a different angle. I also think you're doing tattoos that you wouldn't be doing, because I think even the people that we put to sleep, they're at the tattoo parlor the next day. You know, because there's always more work. We're never finished. You know, it's like we're getting the bulk of it done, or we're doing the sensitive spots. But yeah, I think that relationship probably doesn't exist when you have somebody come in, go to sleep, and have 6 artists work. But let's look at it from a perspective of that particular person wouldn't do the tattoo. They're on tour, they're too busy, they just wouldn't do it, they wouldn't be tattooed. But, you know, I have some other people that are really tattooed up that say, hey, I got this inner thigh area right here that I really want to tattoo, but every time I try, I just can't. So that area would go untattooed. Now we're tattooing it. That relationship-based tattooing still exists because most people don't want to spend $150,000 or $500,000 to get their body tattooed all in one session. And that patient base, that customer base is 1% of 1% of 1%. And I think even though, a segue between the two worlds would be the local anesthesia route. There's no reason why tattoo artists aren't giving local anesthetic. There's no reason. You guys are sticking needles in people's skin. And you guys are, you know, what does it matter if you stick a needle with ink in it, or the needle with lidocaine in it, and a little epinephrine, and you go 2 millimeters deeper, right? You're still gonna have that relationship and talk to the person. And I would even challenge to say that the work might even be just 3% better, 5% better, because you're able to focus and not be interrupted. Who knows?